Dr. Rafich here from Vet Triage. It is Thursday, January 16, 2025, 11:44 a.m. Pacific time. We are going through this issue of Veterinary Surgery from October 2024, and a pretty cool study evaluating preoperative coagulation panels in dogs undergoing liver lobectomy for primary liver tumors, a multi-institutional retrospective study. This study comes out of University of Pennsylvania, University of California in Davis, the Ohio State University, the University of Tennessee, University of Georgia, and Colorado State University. Down below there in the picture, you can see the coagulation cascade. There was at one point during, I don't remember when, there was a study that tried recharacterizing this, and they did it in like a very complex way to sort of just reorganize this whole scale. But I think most of us still use this version. But if it's old school, let me know in the comments section. I've been out of the loop with academia for a while, so maybe there's a new cascade that they've reorganized it. But essentially, you can see there the intrinsic pathway, the extrinsic pathway, and the common pathway, all leading up to the formation of fibrin. And so this is the secondary hemostatic pathway. So just to recap for those who don't know, there's 3 stages to hemostasis, which is stopping bleeding in the body. The first stage is going to be the platelet clot, and we typically use a test of platelet concentration, von Willebrand factor, as well as platelet functionality. And you need those 3 things in order to have the ability to form the platelet plug, which is the initial cessation of bleeding with the platelet plug. And so that test typically that we use to assess that are platelet counts. So we count how many platelets on a slide or through a hemostasis machine, hemostatic machine, or a buccal mucosal bleeding time, a BMBT, both those things. Then, of course, von Willebrand concentration as well. And that's primary coagulation. This is secondary coagulation, where you typically are going to measure either individual coagulation factors or APTT, which is right there, or PT, which is right there. And then the tertiary hemostasis is the breakdown of the fibrin clot. So you're looking for things like D-dimers and things like that. So that in a nutshell is how we typically think of these things. There's more to the story, of course. It's a very cool academic concept with this because it's frequently misused and mistaught and mislearned in practice. So this paper should hopefully shed some more light. The objective of the study is to determine whether operable primary liver tumors were associated with prolongations in prothrombin time, that's PT, and I'm going to say PT from here on out, and activated partial thromboplastin time, which is APTT, which is what I'm going to say from here on out. And also the second goal is to determine if these secondary hemostatic abnormalities were more prevalent with specific liver tumors. This is a multi-institutional retrospective study, 359 dogs. The results show that 20.6% of these dogs had either PT or APTT prolongations preoperatively. 5.6% had both prolongated. Hemangiosarcoma was the only histopathologic diagnosis associated with concurrent prolongations of both PT and APTT, and that was 37.5% of dogs. Clinical significance: the PT and APT testing is low yield as an elective preoperative screening test for dogs with primary liver tumors, except for dogs where hemoabdomen or high suspicion for hepatic hemangiosarcoma exists. Introduction: primary liver tumors account for fewer than 1.5% of all canine tumors. The most common are hepatocellular carcinoma, then hepatocellular adenoma, and then hepatoblastoma. And hepatoblastoma, unless I'm misunderstanding it, that's not one that I've really seen before. So I'm surprised that made the top 3, but there you have it. In another study with 28 dogs with hepatic disease, only 4 of which were neoplastic disease, the PT and APTT were abnormal in 50% and 75% of cases respectively. In a second study, mild to moderate hemorrhage was a complication of liver biopsy in 5% of cases, but the underlying liver pathology in that study was not described. The liver is responsible for the production of all coagulation factors and anticoagulant proteins, including antithrombin, protein C, and protein S. It is also involved in vitamin K-dependent carboxylation activation of prothrombin, protein C, protein S, and coagulation factors 2, 7, 9, and 10. Hepatocytes are involved in the clearing of pro- and anticoagulant byproducts, including D-dimers. Critical role the liver plays in the maintenance of secondary hemostasis is obvious. The thrombin generation declines with decreasing levels of factors 8, 9, or 11. This decrease in thrombin can occur to moderate to severe degrees when these coagulation factors fall to either less than 50% or less than 10 to 20% of normal levels, respectively. Materials and methods for this study. The cases were collected from 2011 to 2022. There was no follow-up with any of these animals. An abnormal state of coagulation was defined as a value above the upper limit of the physiologic range provided by the institution's clinical pathology laboratory for PT and APTT. For dogs where platelet count was available, 50,000 platelets per microliter or less was considered increased risk for bleeding. Results. Hepatocellular carcinoma was diagnosed in 67.4%, hepatocellular adenoma 23.7%, hemangiosarcoma 4.6%, cholangiocellular carcinoma 2.8%, cholangiocellular adenoma 0.8%. The left lateral liver lobe was most commonly affected at 42%, left medial 26.7%. After that, it was caudate at 14.2%, quadrate at 12.5%, right medial and 10.6%, right lateral and 7%. 20.6% of dogs had prolongation of either PT or APTT. A total of 5.6% of dogs had prolongation of both. Dogs with prolongation of both were 6.5 times as likely to have emergency surgery and 2.5 times likely to have a hemoabdomen, compared with dogs that did not have prolongations of both PT and APTT. 60% of dogs with prolongations of both PT and APTT received some kind of transfusion. 2.8% and 8.4% of dogs had individual PT or APTT prolongations greater than 20 to 25% of the upper end of the reference range, respectively. 1.9% had both. A total of 274 dogs had numerical platelet data available with a median platelet count of 442 platelets per microliter, and of these dogs, only 1.5% had a platelet count less than 50,000 per microliter. These dogs were not more likely to have a transfusion or an elevation of both PT and PTT. And I want to stress that point, because even though it may not be a lot of cases in this paper, just because you have a hemoabdomen, which is a problem, which is a bleeding disorder of a body cavity, right? It's the abdominal cavity, does not mean you've got a primary hemostasis problem, meaning bleeding in the abdominal cavity does not mean you have an abnormal platelet count, platelet function, or von Willebrand's factor. That's a primary coagulation cascade issue, which is the platelet plug. Secondary hemostasis issues, like in the chart below, that causes bleeding in body cavities, chest, abdomen, joints, spinal epidural space, the subdural, so in the brain. So that it does make sense that dogs that have low platelets did not have any correlation with abnormalities in PT and PTT, because those tests don't measure the platelets. And platelet issues doesn't necessarily mean you're going to have bleeding in body cavities. Hemangiosarcoma, 16 dogs, was the only diagnosis correlated with PT and APTT, with 37.5% of dogs affected. A total of 62.5% of dogs diagnosed with hemangiosarcoma also had a hemoabdomen and emergency surgery. Hepatocellular carcinoma was the only other histopath diagnosis found to have a significant association with emergency surgery. Dogs with hemangiosarcoma of the liver were not more likely to receive a transfusion. Okay, discussion. In this study, prolongations in both PT and APTT were found in 5.6% of dogs. 1.9% had prolongations of both, more than 20 to 25% above the reference range. Results can generally be considered abnormal when there is a prolongation of or shortening of PT or PTT greater than 20 to 25% over the normal control time. Dogs with both values prolonged were more likely to have emergencies, a hemoabdomen, and receive blood transfusions. Prothrombin time and APTT were originally used as screening tests for people with a personal or familial history of bleeding. The PT assay involves the addition of phospholipids with tissue factor and calcium to citrated plasma to assess the integrity of the extrinsic and common pathways. And that's in that chart there. A prolonged PT in the face of normal APTT can indicate factor 7 deficiency, early vitamin K antagonism or deficiency, or synthetic liver failure. Although with synthetic liver failure, you typically have elevations of both PT and APTT. Testing of the intrinsic, and just to be clear again, the reason why this is because if you look at this at the PT and PTT, both measure common pathway, right? So if you have a problem with only extrinsic pathway, then you're going to have a normal APTT and an abnormal PT. If you have a problem with the common pathway, both PT and APTT will be prolonged. Testing of the intrinsic and common pathways with the APTT is performed in a similar fashion to PT with the exclusion of tissue factor as a reagent and the addition of an intrinsic pathway activator such as Callan. A normal PT with a prolonged APTT could indicate factors 8, 9, or 11 deficiency, disseminated intravascular coagulation or DIC, and synthetic liver failure. When both are elevated, potential causes include multiple factor deficiencies involving the extrinsic, intrinsic, and common pathways, or single factors that are in the common pathways like factor 10, 5, 2, and fibrinogen. Vitamin K antagonism deficiency, synthetic liver failure, DIC, massive bleeding, or dilutional coagulopathy due to fluid resuscitation also can do that. All right. Both PT and APTT are highly susceptible to artifacts due to flaws in sample collection or pathologic conditions. Coagulation results can be erroneous, secondary to difficult or traumatic phlebotomy, prolonged action of a tourniquet, inadequate sample volume, failure to adjust amount of citrate in the face of significantly elevated hematocrit. In veterinary medicine, prolongations of APTT can be seen in non-pathologic conditions like Hageman factor, which is factor 12 deficiency. In a systematic review of 7 human studies, APTT was elevated in 6.5% of patients. 4 studies had likelihood ratios calculated showing that an abnormal APTT was not predictive of perioperative hemorrhage. In the same study, a similar conclusion was made for PT. Another test known as thromboelastography addresses several concerns with the use of PT and APTT while providing more information. The viscoelastic properties of the blood clot are evaluated through every phase of coagulation, including initiation, amplification, propagation, and fibrinolysis. This allows a global assessment of hemostasis, including both plasma and cellular components, and the interaction between each. Such an environment more accurately reflects the in vivo hemostasis compared with other hemostatic tests. Another study documented all 10 dogs enrolled with extrahepatic biliary duct obstruction were hypercoagulable based on the results of thromboelastography while maintaining a normal PT and APTT. The frequency of hepatocellular carcinoma in this study, which is 67.4%, is consistent with published reports of 50% to 70%. Hepatocellular adenoma were found to be the second most common hepatobiliary neoplasia at 23.7%, comparable to previous reports of 30%. Cholangiocellular adenoma, 0.84%, and cholangiocellular carcinoma at 2.79% were less frequent than other studies of 12% and 22% respectively. Differentiated neuroendocrine carcinoma was only found in 0.56% of dogs, less than the reported 14%. And I would say that's more in line with what I see too. Neuroendocrine carcinoma is not common at all. Primary hepatic hemangiosarcoma is 6% of dogs in this study, or 6% of dogs in other studies, 4.4% in this study. And I would say, yeah, that's probably true too. Most hemangiosarcoma I see of the liver are metastatic from like splenic hemangiosarcoma. Another study evaluating hemostatic abnormalities in dogs with hemangiosarcoma found that 70.8% had prolongations in both PT and APTT, which is more than this study of 37.5%. Oncogenic cells are known to promote a thrombotic state through disruption of Virchow's triad, leading to venous thromboembolism and in most severe cases DIC. Following clot formation, tumor-associated blood vessels are prone to disruption due to lack of oxygen and nutrient delivery, with subsequent vessel rupture and third spacing of blood. Contrast-enhanced ultrasound is a developing imaging modality in veterinary medicine that's been used in people to help differentiate between hepatic malignancies. And the importance of that is to say, If you have a suspicion of a hepatic malignancy, then you're more likely to want to test a PT-PTT. And we frequently don't know if it's a malignancy or not without either biopsying it, which is usually low yield, or going to surgery and actually removing the liver lobectomy, in which case you know what the biopsy results are, but you didn't know before surgery, and so it's kind of too late to know if you're trying to decide if you're going to do surgery for your dog or euthanize your dog in that scenario. Preoperative comprehensive hemostatic profiling to include PT, APTT, D-dimers, and platelet may be warranted for dogs suspected to have hemangiosarcoma of the liver. Finally, in conclusion, the results of the study suggest that the measurement of PT and APTT provide low yield as the preoperative screening test for potential coagulopathy associated surgical hemorrhage in dogs with primary liver tumors. So I'm a fan of this type of study. Of course, you can make the same criticisms. You want more animals. You want it to be more standardized across the board. There are many other factors they could have looked at too, but because these cases are not standardized, like follow-up, for example, and all that, it's hard to make further conclusions. But I think very useful and a good educational tool for veterinarians who are still learning about this stuff. So thanks everybody who watched and support the channel. We'll see you again tomorrow. Take care.